Dr. Rafich here from Vet Triage. We are going through this issue of JAVMA from June 15, 2015. Cervical wedge resection for treatment of pyometra secondary to transluminal cervical adhesions in 6 mares. This publication comes out of the Veterinary College in Texas A&M. Case description: 6 mares with pyometra secondary to transluminal cervical adhesions were examined. And for those who are interested, I have lots of pyometra talks on my YouTube channel. They are, of course, oriented towards dogs, but if you want to learn more about that, feel free to check that out. Clinical findings: all the mares, or 5 mares, had infertility, and another one had colic. Palpation through the rectum revealed uterine distension. They did transrectal ultrasonography, which showed echogenic fluid in the uterus. Cervical palpation with vaginal speculum examination indicated transluminal cervical adhesions. They had 3 of the mares had severe distortion of the cervix from diverticula and fibrosis. All of them had pyometra from transluminal cervical adhesions. Treatment and outcome: the cervical adhesions were manually broken down to establish a patent cervical lumen to accommodate uterine lavage catheter, uterus lavage, 0.05% povidone iodine solution, cervical surgery, sedation, and caudal epidural anesthesia. Full thickness wedge-shaped defect was made in the dorsolateral aspect of the cervix, creating a permanent opening to the uterus. All 6 mares had patent cervices and resolution of pyometra postoperatively. Conclusion: cervical wedge resection enabled treatment of pyometra in mares with transluminal cervical adhesions without the need for ovariohysterectomy. All right. So this is a case series. So we're just going to go through unique aspects that I did not already mention in the summary here. Palpation per rectum of the reproductive tract revealed markedly distended uterus with normal-sized ovaries. Uterine wall was thick, over 2 centimeters, both horns and the body. Sedation, detomidine, butorphanol. They gave oxytocin for lavage or after lavage to encourage evacuation of uterine contents. They cultured Streptococcus equi subspecies zooepidemicus, and the uterus was infused once a day after lavage with 3.1 grams of ticarcillin disodium and clavanolate potassium. This was performed daily for 7 days until the uterine effluent was clear and the uterus retained minimal or no fluid. They also treated with tetanus prophylactically and flunixin meglumine. For the surgery, they placed 2 stay sutures, dorsolateral aspect of cervix, adjacent to the site of intended surgical resection. Tension was placed on the stay sutures, retracting the cervix caudally and creating the wedge-shaped defect. Full thickness wedge-shaped defect in the cervix was created with the apex pointed cranially from the external os and extending to the internal os. The base of the wedge measured 3 to 4 centimeters wide, lumen 2 to 3 centimeters in diameter near the internal os. Topical application of a compounded ointment made of dexamethasone and oxytetracycline. They also had lanolin or vitamin A and D ointment. Procainamide, penicillin G, gentamicin sulfate. Long-term follow-up, 5 years. Producing a live foal was unsuccessful because of poor oocyte quality. Median volume of fluid removed from the initial uterine lavage, 29 liters, which ranged from 5 to 80 liters, with a median of 4.8 days of lavage prior to cervical surgery, ranging from 3 to 7 days. Other bacteria: Proteus vulgaris, Pasteurella, bipolars species, and Coccolobolus species. Discussion: the cervix provides the third and final barrier between the uterus and the external environment in the mare's reproductive tract. The cervix is a dynamic structure that operates under hormonal influence of estrous cycle. During periods of estrus, cervical relaxation permits semen to move into the uterus and allows for clearance of uterine contaminants after breeding. During diestrus and pregnancy, the cervix forms a seal that protects the uterine environment from contaminants within the vaginal vault. When fully dilated during parturition, it allows for passage of the foal. If the function of the cervix is compromised, the fertility of the mare is adversely affected. Adhesions of the cervix are one of the reported pathological conditions that impairs the reproductive ability of mares Adhesions that prevent the cervix from opening may be transluminal or vaginal in origin. Adhesions commonly result from trauma, such as lacerations sustained during parturition or attempts to resolve a dystocia or repeated efforts at cervical manipulation that occur as a result of intrauterine treatment, artificial insemination, or embryo transfer. Therefore, mares of any parity, P-A-R-I-T-Y, status may have cervical adhesions. Regardless of the cause, mares with transluminal cervical adhesions are at risk for the development of pyometra as a result of mechanical impairment of uterine clearance mechanisms. Pyometra is defined as the accumulation of mucopurulent material within the uterus. Most mares with pyometra only have involvement of the endometrium of the uterus, but in rare cases, mares can develop metritis and systemic illness like fever and endotoxemia. Severe uterine enlargement resulting from pyometra can result in weight loss, poor performance, colic. Regardless of severity, all mares with pyometra are considered infertile when bred by conventional methods because the uterine environment cannot support the embryo development. Diagnosis of pyometra is determined by transrectal palpation of an enlarged non-gravid uterus, along with the ultrasonographic appearance of hyperechoic uterine fluid accumulation. Positive bacteria or fungal culture of the endometrium supports diagnosis. Treatment of the pyometra consists of dilating the cervix so as to enable uterine lavage and intrauterine treatment. Systemic administration of oxytocin or prostaglandins and exercise after lavage may encourage expulsion of uterine contents. In severe intraluminal cervical adhesions where patency cannot be maintained and pyometra recurs, ovariohysterectomy has been the only reported option for treatment. Although routinely performed in dogs and cats, ovariohysterectomy in mares is uncommon, more difficult, and invasive. Because of the pelvic location of the uterus in mares, surgical access can be challenging. Complications after spaying include death, uterine and intra-abdominal hemorrhage, septic peritonitis, colic, ileus, diarrhea, intermittent fever, jugular vein thrombosis, uterine stump necrosis and abscess formation, and incision infection. Uterine lavage is done prior to surgery. An obvious sequela of ovariohysterectomy is permanent sterility. For mares with pyometra secondary to transluminal cervical adhesions in the present report, the cervical wedge resection enabled treatment of pyometra in all mares and allowed for production of foals by embryo transfer in one of the mares. The procedure is minimally invasive with few complications and economically advantageous compared with spaying. It is important to achieve temporary patency of the cervix prior to surgery to remove the mucopurulent content of the uterus. Trauma to the cervix often initiates an inflammatory reaction exceeding those that occur in the vagina or vestibule. A fibrin scaffold is produced, and if inadequate fibrinolysis occurs, fibroblasts can migrate over the scaffold and begin neovascularization. As a result, collagen is produced and adhesions can form. Removal of the wedge-shaped defect from the cervix leaves exposed submucosal and muscular surfaces that are vulnerable to further adhesion formation. Application of the compounded ointment appears to help promote reepithelialization and minimize adhesion formation. Additionally, manual palpation of the defect during application of the ointment helps ensure the cervix heals in a patent position. Mares of pyometra secondary to cervical adhesions are infertile when bred by conventional methods as a result of impairment of the cervical function and chronic endometrial damage. Once a mare undergoes a cervical wedge resection, its cervix is rendered incompetent and the mare can never support a pregnancy to term. However, mares may still produce foals with assisted reproductive techniques. Mares that are unable to provide embryos by routine embryo transfer methods may still produce foals through transcutaneous or transvaginal aspiration of oocytes and intracytoplasmic sperm injection or oocyte transfer to produce viable embryos. Prior to oocyte aspiration, uterine lavage may still be necessary to decrease uterine size to facilitate manipulation of the ovaries and to reduce the potential for peritoneal contamination. Provided the mare's breed registry allows for foals to be produced with assisted reproductive techniques, the cervical wedge resection can help preserve the ability for these mares to continue to produce valuable genetic material to their breed. So it's just a case series, but it's always impresses me that these veterinarians are are brave enough to try a new surgical technique like this. I don't know. I guess there's not been other reports of the surgery, but in any case, so for veterinarians, keep in mind that this is potentially an option. I don't know if there's enough description here of the surgery itself to actually learn how to do it, but that's up to the veterinarian to decide. And then for equine owners, realize that pyometra is not the end-all be-all. Apparently there are ways to still breed that mare, although it's going to be a whole process. But for valuable mares whose offspring are valuable, I suppose it is an option for you. All right, we'll see you guys again tomorrow. Take care.